Whether you are a resident at one of our senior living communities or a family member, I want to say thank you on behalf of Buckner. Thank you for your patience and understanding as we navigate uncharted waters with this global pandemic. Thank you for your passion and support. Thank you for your trust. We are doing everything possible to continue to deserve it. And thank you for all the emails in response to the Grassroots Initiative calling on Texas officials to reopen our healthcare areas for limited and safe visits. Throughout the pandemic, Buckner has operated with a commitment to transparency. And in that spirit, I want to read to you a few of those emails. The first says, "Thank you for your efforts in getting us back together with our loved ones. It hasn't been easy. In fact, it's been a very frustrating experience being apart. I couldn't agree more of the negative effect isolation has on our residents." Another one says, "Residents need their families." Another family wrote, "It seems an odd time to open communities to residents given the spiking cases. But I do agree that this is a devastating time to all concerned and a solution should be found. We hear you and we value your feedback. Just as we are asking government officials to include senior living industry representatives in their strategic planning, we too are committed to hearing your advice and concerns when developing our own plans. We believe an integral component to in-person healthcare visits is rapid point-of-entry testing. If we can confirm that a guest is negative for the virus at that very moment, then we are able to operate with the necessary confidence in reuniting families. Of course, for that to happen, it is important that the state and federal officials prioritize COVID-19 testing for senior living communities and provide us with the same access to tests and financial support as hospitals and physicians. I have heard many heartbreaking stories of isolation and loneliness. Even some spouses residing in the same community are kept apart if they live in different care levels. What was once a short walk across the building might as well be 1,000 miles. 1 month after the state announced its efforts to reopen healthcare to visitors, less than 1% of nursing facilities in the state were able to meet the requirements. This inability can be attributed to a number of reasons, from how one positive case can prevent visitors for 1 month to the high cost associated with weekly testing of staff. And what of those facilities that met the requirements? The only visiting options currently allowed include closed windows, giant plexiglass barriers, or outdoor, socially distanced visits. That still does not help our married couples unable to hold hands after half a year. That's why we are fighting for a more comprehensive solution across the state, and why we still need your help. If you have not, please email me at the address below. I'll send you the letter I sent Governor Abbott. Everyone's voices are important as we move forward together. If we push for readily available, rapid testing, and PPE combined with effective regulations, we can implement limited, in-person healthcare visits that will unite families while warding off the virus. Thank you for allowing us to serve you, and God bless.